Hi, I'm Sue, student nurse at Western Sydney, and I'm back. So today's topic is about pain. When I'm talking about pain, I don't refer to this.
They ask you how you are, you just have to say that you're fine, and you're not really fine, but you just can't get into it because they would never understand.
So understand the pain perception. They will help people to control their emotional responses to pain appropriately in any situations and realize scientific behind pain perception. So pain perception is one of a topic about nursing interventions. So to manage pain for post-operative surgery. So that's why it's important to know pain perceptions if you're studying nursing. So in data, the Australian Institute of Health and Welfare indicates that 3.3 million people have had suicide thoughts in their lifetimes. So the number is 644,600 people have had suicide thoughts in the past 12 months. And the suicide-related factor linked to mental health, the socio-demographic factors, peer influences, and having pain perception. So now let's get to know what is pain. So, in the International Association of the Study of Pain, define pains as an unpleasant sensory and emotional experience associated with actual potential tissue damage or described in terms of such damages. And it is subjective experience influenced by biological, psychological, and social factor. But for my definition of pain, I refer pain as an uncomfortable, sorrowful damages impacting the feelings and sensations to trigger human receptor in varied responses, socio-emotionally and pathophysiologically. So the upbringing value reflects on human experience to develop pain and memorize previous events. So pain is influenced by social belief, attitudes, and personality. And before we explore the pathophysiology of pain, we need to know the terminology and understand its function first. So what is nociceptor? Nociceptor refers to pain sensory receptors located in the human skin, muscles, joints, visceral organs, and other tissues. The nociceptors respond to stimulus, example of mechanical pressures, extreme weather, or chemical exposure, etc. So what are the role of nociceptor in pain perception? The role of nociceptors in pain perception is to alert the body to perform actions, trigger reflexes. For example, you jump out from the window when you spot a ghost, or deliver consciousness to the brain. And there are many types of nociceptors, and it's only two types. So one is high threshold mechanoreceptor, known as HTM. It's an A delta fiber, so alpha delta fiber, respond to mechanical deformation. And then the second one is polymodal nociceptor, known as PMN. It's a C fiber, respond to a variety of tissue damages inputs. So during information transmission, afferent nerve fiber includes alpha delta fiber and polymodal receptor or C fiber. The alpha delta fiber respond to fast myelinated, sharp pain, and localized pain. Example, got cut by a knife or something like that. And then the second one is polymodal receptor. It's the C fiber. It responds to slow, unmyelinated, dual pain, burning, or diffuse pain. Example, muscle soreness. So let's get to know pain anatomy. Example of tissue injury is examined through the levels of cuts or injury that develop further duration of pain. So pain threshold refers to minimum pain intensity at the starting point, and then pain tolerance refers to maximum pain intensity at the breaking point. So the pain pathway consists of three neurons. It connects peripheral tissues like skin, muscle, or viscera with the cerebral cortex of the brain. Nociceptors involved into uh, the the pain anatomy is the first neuron, nociceptor. The second neuron is the spinal thalamic tract, and the third one is the thalamocortical neuron. Okay. The anatomy of pain pathway begins with the ascending, so it's upward motion. When the stimulus activate nociceptor at the spinal cord, then transmit noxious impulses into the nervous system of the brain. The brain has the control system to interpret the information and generate responses to suit with that situation. And then noxious travel descending or downward motion from the brain to the spinal cord and to other organs to respond to behavior, alternative reaction, or facial expressions. This process described as pain anatomy, and it happens to human in very quick duration after experiencing pain. The human reflex acts and body responses to pain really quick. When there is slow response to pain, the body becomes insensitivity and neurological function is progressing slow or malfunction. So what is the pathophysiology of pain? Pathophysiology of pain classified into four steps. Step one, transduction. Step two, transmission. Step three, perception. And step four, modulation. So in step one, it's transduction. It's a pain signal generated step. So tissue injury will then activate inflammatory response due to release of bradykinin, prostaglandin, substance P, and histamine. Those are chemical release of the immune system that activate inflammatory response, and it causes signs of inflammation like redness, swelling, pain, or heat. So in this part, these chemical releases activate nociceptor or pain receptor located in the peripheral nervous system. And then nociceptor converts those stimuluses into electrical signal or impulses, we know as action potential. And then in the next step is transmission. It's how the pain travel or spread. So nerve fiber sends signal to central nervous system and involve neuron functions. Electrical impulses travel with afferent nerve fiber to the cell horn of the spinal cord and of the central nervous system. So afferent nerve fiber will include the alpha delta fiber and polymodal nociceptor or the C fiber. And a delta mechanosensitive receptor respond to myelinated if pain, and it's accelerate the transmission of the nexus. So it's improved, it's quicker. And then a delta mechanothermal receptor is another delta receptor. It's respond to pressure or heat or cold temperature. Electrical signals sent to the dorsal horn of the spinal cord. Then the second order of the neuron synapse transmits the information to the opposite side of the brain. In the control center of the brain, our brain relays the signals from spinothalamic tract to the thalamus inside the brain. Then there is a relay station at the spinothalamic tract. So then into the next step is step three. It's when pain center receptions, it receives the pain information and then interpret to action awareness. So how it interpret? It involves thalamus forward the signal to somatosensory cortex, and then to limbic system, and then to the prefrontal cortex. So when thalamus forward the signal to somatosensory cortex, sensory cortex identify the location of pain and intensity of pain. Then the limbic system activate emotional response to pain, and our prefrontal cortex modulate pain's interpretation. And then the pain, to go to the last step of the physiology, the pain pathway, it's modulation when it regulates pain in the central nervous system. So brain and spinal cord release either happy hormone or sad hormone. And it involves endogenous opioid like endorphin or acetylcholine hormone or neurotransmitters that include serotonin or norepinephrine, if I pronounce incorrect. But these two hormones can produce either pain perceptions, response to either happy or unhappy. And these happy hormones inhibit pain transmission and reduce perception. So to recap, the pathophysiology process of example, a tissue injury lead to conscious perception of pain, where following step like transduction, when tissue injury stimulate noxious stimuli and activate nociceptor. Then nociceptor converts noxious into electrical impulses. And then transmission step, the afferent nerve fiber transport those signals to the cell horn of spinal cord of the central nervous system. The second order of neuron synapse impulses from spinal thalamus to thalamic of the brain. Then pain perception when the thalamus cortex forwards noxious to proceed action awareness. And then modulation is when excitatory amino acid or EAA, it inhibited pain and amplified noxious information where hormone releases. And there are organs, and there are organs involving responses to pain in pain sensitivity, like in step one, transduction. Remember the organs and um, the nerve fibers include nociceptor, afferent nerve fiber, the cell horn, and thalamus. And then in transmission and perception, the step two and three, it involves the cell horn of the spinal cord in the peripheral nervous system. And then the last part is consciousness awareness in modulation. It involves cortical and subcortical. Cortical includes somatosensory cortex, insular or limbic system, and anterior cingulate cortex, or known as prefrontal cortex. And then the subcortical includes hypothalamus, thalamus, amygdala, and hippocampus. These cortex and thalamus activate our emotional responses. So let's get to know how many types of pain. There are different types of pain. Um, Now we have acute pain, subacute pain, recurrent pain, chronic pain, nociceptive pain, neuropathic pain, and refer pain or phantom pain. So let's start with acute pain. It's the short term. It's sudden, like example surgery, trauma, or other condition like denture, puncture, or period pain. It heals. The healing can be resolved. Medication can administer like non-opioid analgesic like paracetamol or maybe opioid like morphine, aspirin, codeine, etc. Subacute pain is can last from 1 to 3 months. It intermittent or persistent depends on intensity. If persistent, it develops into chronic pain. And subacute pain, example like arthritis, neuropathic pain, laceration, kidney stone or burns. There's a transition phase that healing period expecting in subacute pain, and medication or again can administer paracetamol or NSAID drug, and these subacute pain can be prevented. Then we have recurrent pain, pain that lasts 2 minutes to from minutes to days, and then it comes back. It reoccur over time. It repeated pattern. Pain is identifiable and it influenced by stress, diet, environmental changes. It occurs on a cyclical basis. Example like migraine pain, pelvic pain, period pain, and stress. Recurrent medication can administer as opioid analgesic or antidepressants for recurrent pain. Then the next type is chronic pain. It lasts from 3 to 6 months. It's not below that, and it heals requires scientific treatment. It's persistent. Example like arthritis, neuropathic pain, and medication, opioid, and antidepressants can help with chronic pain, and it affects the tissues and nerves. The next type is nociceptive pain. It's the causes in tissue inflammation. So it classified into two types, nociceptive pain, the visceral nociceptive and the somatic nociceptive. The visceral nociceptive pain originates within the internal organ, like lungs or heart, etc. It's colicky. It's like example of colicky, like abdominal pain. So nausea, autonomic disturbance, appendicitis, kidney stones, period pain, heart attack. This pain does not show image physically. It's invisible, but respond to distension, inflammation, and ischemia. Somatic nociceptive pain occurs within the musculoskeletal body system. It causes by stimulus such as cuts, crushing, or insect bites. The common injury site are muscle, bone, joints, pain, etc., like fracture or sprain. And then we have another type is neuropathic pain. It's abnormal pain. It's the pain that caused by injury or disease and of the nervous system rather than peripheral tissues. So it affects the cognitive ability and the nerves. These abnormal sensations respond to injury caused by primary lesions or dysfunctions to nervous system. So it's result in dysfunction to motor system, sensory dysfunction, or autonomic dysfunction. Result from the nerve damage or dysfunction, etc., like diabetic, neuropathy, or sciatica. Patient may report spontaneous pain in the absence of the obvious peripheral pain and describe as burning, shooting, tingling, numb, stabbing sensation, or when a person gets shingle. Shingle develop from chickenpox and it reduces the rashes. Neuropathic pain characterized by evoked pain. So it's divided into 5 categories of neuropathic pain. So the first one is allodynia. If I pronounce it incorrect, don't mind me. Allodynia or allodynia. So it's a painful response to a normal innocuous stimulus, not harmful stimulus. Example like allergy reaction. And then we have hyperalgesic. So it's abnormal severity of pain following a noxious stimulus. So example of irritation of the skin. And then hyperpathia, it's exaggerated pain and prolonged response. So it delay onset, then explosive. Example like injection. And then hyperastasia, it increases sensitivity to stimulation. Example like prolonged injection at the site. When, example, you get vaccination and the needle into your muscle, they put it into for too long, or you get a blood collecting and they put the needle into your muscle for too long, that's when you feel the hyperastasia. And then diastasia is when the discomfort rather than pain, like evoke alta sensation. Example, diabetic neuropathy or hungry. Then the next type of pain is referred pain. It's originated from the actual source. Example, heart attack causes the left arm pain. And the last one is phantom pain, the pain that feel in the limb or the body part that has been amputated. So these are types of pain. Then we need to know the sympathetic nervous response if you study nursing. So responses for the nervous system consist of when it increases heart rate, blood pressure, cardiac output, ventilation rate, blood glucose level, and adrenaline output. The role of sympathetic nervous system, when it's abnormal sympathetic outflow to injure extremity in response to neuropathic pain, it may cause abnormal regulation or vasculature, edema, discoloration, changes in sweating, temperature changes, traffic changes in skin, reduced motor activities in the affected part. So pain inflammation from the face. So we can observe pain from facial expression as well by look at the trigeminal nerves during pain perceptions. So trigeminal nerve during pain perception includes three types. The V1, it's when the forehead, we look at the forehead, and the V2 look at the cheek, and the V3 look at the nerve chin. So understand types of nursing intervention for pain management. There's different types of nursing intervention for pain management. It includes distraction therapy, chemotherapy, meditation, guided imagery, and non-pharmacological intervention. So distraction therapy like exercise, massage, playing something like competitive games, etc., that distracts the patient to eliminate or reduce the pain sensation. Then chemotherapy, like pharmacological intervention, is administration of medication like opioid or analgesic, like on synaptic transmission in the central nervous system bind to natural opioid receptor. Then non-opioid analgesic medication reduce inflammation and pain like aspirin or paracetamol. And anti-epileptic like reduce excitement and conduction of neuron in the central nervous system. And we can also administer NSAID drug, non-steroidal anti-inflammatory drug, and adjuvant analgesic or co-analgesic, and apply transdermal cream or lotions. Those are basic chemotherapy for pain management. Then meditation is another part like patient positioning, relaxing postures, and recovery position, etc. And then guided imagery is another part like illustrated image education or entertainment, where and also cognitive behavior therapy as well. And then non-pharmacological intervention when you apply ice pack or heat pad to reduce pain, where sensation touching. So these are all different types of nursing intervention. And finally, here are references available upon request. And thank you so much for watching. If you like the video, please do like, subscribe to my channel for more, and see you in the next one. Thank you.